Many people experience dry eyes or irritation in their eyes. They try drops, they try all sorts of things, and it just does not work. But did you know that your eyelids could be the very problem? There are two eyelid malpositions that we are going to discuss today: Entropion and Ectropion. What is that? Well, you'll have to watch to find out what that is. This is the Dr. Tebz Show, where we're putting your health back into your hands. So to discuss this very fascinating and important topic is Dr. Hamza Mustak. He is a qualified ophthalmologist who's heading up the orbital oculoplastics unit at Grooteskier Hospital, as well as the ocular oncology unit at Grooteskier Hospital. And he also has a private practice at the Atlantic Eye Center right here in Cape Town. And I'm very privileged to have him join me today. So hello Hamza, how are you?
Good, thanks. How are you, Tebz?
I'm good, thank you. Thank you so much for joining me today.
Thanks for having me.
So can you first outline what is the anatomy of the eyelid? Because this is where the problem is when we're discussing entropion and ectropions.
Yeah. So, as an oculoplastic surgeon, obviously I have a bias towards the eyelids. But I think one of the misconceptions is that the eyelids are like windscreen wipers for the eye. You know? And I think it's not as simple as that. So the eyelids are actually quite complex structures that play an integral role, a very important role in maintaining the health of the eye surface. And if the eyelids are not functioning properly, it will affect the surface of the eye health, which have multiple consequences, both symptoms like irritation, like you described, as well as affect your vision, which is what a lot of people don't realize. And so when you look at the anatomy of the eyelid, it's actually quite complex. And in fact, a lot of our trainees struggle to conceptualize the different layers and anatomical components of the eyelid. And so if we look at your eyelids, we have an upper and a lower eyelid, as we all know, and both of them meet in the corners, on the inner and the outer corner. And so they act like a shutter, and part of their role is to protect their eye from that point of view. But it's made up of your eyelashes, obviously, the skin over the eyelid, the muscle that allows for the closure of the eyelid. Then there's the cartilaginous plate, or what we call the tarsal plate, which contains oil glands within it, as well as an attachment point for the muscle that lifts up the eyelid. And on the inner lining is the what we call the conjunctiva, or the inner lining of the lid that goes onto the eyeball itself. Having
described the anatomy so beautifully, can you now tell, or explain what is entropion, what is an ectropion, and how do they come about?
Okay, so the way I explain it is to use the eyelashes as a reference. So the eyelashes would sort of point, outwards and upwards on the upper lid, and then upwards and downwards on the lower lid. And they act as they're a protective mechanism, acting as a net, as well as making people beautiful.
You look pretty, thank you.
And so that's the orientation you want for the eyelashes. So the one way to think about it is that if your eyelid turns inwards, that's called entropion, then the eyelashes are pointed towards the eyeball, which you don't want because they'll end up scratching the eyeball. And if the eyelashes turn further outwards, then that's ectropion, or turning outward of the eyelid. The problem with that is that it exposes the inner lining of the eyelid, which is supposed to be moist and not dried out. And so if it's exposed to the air and the environment, it dries out, and that's what causes the irritation for ectropion.
Okay. So who gets an entropion and who gets an ectropion?
Okay, so they're different causes, and some are common to both and some are unique to both. So if we look at entropion, for example, the most common cause for entropion is in elderly patients, and those are related to age-related changes. So part of the muscles stretch out, and then you get instability of the eyelid because of there's laxity of your eyelid. And so if there's that instability, then the eyelid can turn inwards. And so that's what we call involutional or age-related entropion. Then the other that we might see is what we call cicatricial or scar-related entropion. And that's where patients have either had trauma, like a chemical injury to the eye, or conditions which cause inflammation and scarring of the inner lining of the eyelid. And that scarring pulls the eyelid inwards.
Okay. So who gets it? So who is it? Old people, young people, anybody?
So it can affect anyone,
Right.
depending on the cause. So as I said, with involutional, it's more age-related changes. And in younger patients, we tend to see sort of more cicatricial or scar-related entropion, or certain patients who get a lot of irritation and spasm of your eyelid muscles, and can also get entropion.
Okay, so like, how do you treat it? How, you know, can you just say, oh, here's lubricants? Because most people don't want operations. But,
Sure.
but what is the treatment of entropion or ectropion?
So the treatment, again, depends on what the cause is,
Yeah.
and also what the severity of the condition is. And so if we see entropion or ectropion that's quite severe and actually causing scratching, irritation and scarring of the front surface of the eye, then those often need more drastic approaches to management, which is often surgical. But if it's milder and not really, causing too much dysfunction, then you might get away with giving lubricating eye drops, as you might have said, or simple moves like stretching of the eyelid for ectropion, where there's skin tightening, for example. So there are conservative measures, but that would obviously be discussed by the ophthalmologist who would be looking after you.
Yeah, but what are the complications if you actually let this go on for too long? You know, because some people will say, you know what, I'm just going to wait and wait and wait. Maybe this thing will just resolve, you know.
Sure.
So what could happen?
So, like we're saying, the lids are important in maintaining the health of the eye surface. And so if there's a malposition of them, then you can get disruption of the protective mechanisms.
Yes.
And in fact, they become harmful. So with entropion, the lashes then end up scratching on the cornea. And the cornea is the most sensitive sort of structure of your eye, probably. Most people would have had a hair or grain of sand go in the eye, and you can understand that constant irritation. And so if the eyelid is rotated well inwards, where the lashes are constantly scratching, then it can actually cause scarring, infections can develop in the cornea, and it can actually lead to blindness.
Yeah, exactly.
So just to add on to that, if we look in certain parts of Africa, one of the leading causes of blindness is a condition called trachoma, which is where they get recurrent infections of the inner lining of the lid, which causes scarring, gets the eyelid to turn in, and then they develop corneal scarring over time.
Exactly. And so now the patient knows, okay, if I don't do the operation, let's say it's severe, right, and they need the operation and they get the operation, but now they want to find out, okay, doc, before I go under the knife, what are the complications of the actual surgery? What can go wrong? Can I be worse off than my little entropion or ectropion after the operation?
It's a good question. It's and a slightly tricky one to answer. What's interesting about oculoplastics is that there's been an evolution in terms of the way we do surgery. So from big open surgeries where large incisions were made and cuts were made, to more micro-incisional techniques. And luckily for us oculoplastic surgeons, the eyelid is quite a forgiving area to work with surgically, because the face has got a rich blood supply, and so that includes the eyelids. The risks of getting an infection after surgery are quite low, but if you're talking about some of the risks, then infection is one of the risks. Recurrence of the problem is one of the risks, but and so the chance of that is about anywhere between sort of 5 to 7% recurrence. The chance of infection is exceedingly rare, thankfully. But because we are working on the eyelid and around the eye, there have been reported cases of vision loss from that, but that's related to bleeding behind the eye, or what you call a retrobulbar hemorrhage. So it's important to be aware of that. But thankfully, again, as I said, those are exceedingly rare.
Yeah, no, that's very true. It is exceedingly rare. So thank you very much, Dr. Mustak, for having explained. So I mean, you explained it in depth and very comprehensively. So in closing, what are your final thoughts or closing thoughts on this topic?
So, I mean, if I look at my practice, I'd say it's actually quite a common condition that exists, and I think patients often think the irritation is going to go away, or if you know, if they use eye gene or eye drops, it might get better. But what I would say is that if it's persistent and continuing, then I'd encourage you to, you know, see an ophthalmologist or your GP as a start, even just to if they can pick up what might be causing the irritation, because there is treatment available. And like I say, these days the advances in our surgical techniques means it's a day case procedure, which can be done under local anesthetic or with a little bit of light sedation.
Okay, so it's not necessarily having to be put to sleep then.
Exactly.
So I think that puts half of the stress out.
Definitely.
But thank you very much for joining me today. I thoroughly enjoyed this conversation.
Pleasure. Thanks for having me.
And to you viewers, thank you so much for joining us on this episode where we were talking about entropion and ectropion. If you would like more information about this topic, or you'd like to find out how you could get into contact with Dr. Mustak, we shall leave those details in the description box below. And please don't forget to share, like, subscribe, and push the notification button so you know when we post our next episode. So until next time, take care of yourselves, take care of each other, and remember, your health is in your hands. God bless.